Hello and welcome back to Silvia's Health Hints Summer Edition, again in Parco di Orticultura with a beautiful view of Florence behind me. And today I would like to talk about a male problem, about erectile dysfunction. Maybe you don't know, but erectile dysfunction is really a widespread and a feared health problem in the male population, which can have different causes. The causes range from purely biological medical to psychological causes, and all their mixed forms. For this reason, the therapies need to be multifactorial and interdisciplinary. Almost always, psychotherapeutic support is necessary. Even in case of purely organic causes, the erectile dysfunction always generates also psychological stress in the person concerned and in their relationship with a partner. Conversely, problems within the relationship or other psychological disorders or simply stress can cause an erectile dysfunction even without any organic disease or risk factor. Okay, so now we talk about the different types of erectile dysfunction. We make the difference between temporary, intermittent and permanent erectile dysfunction, according to the duration and occurrence. We distinguish between psychogenic erectile dysfunction with psychological causes and somatogenic forms with organic causes. In reality, we are often dealing, in most cases, these are mixed forms, as already mentioned. Even the purely organic erectile dysfunction is always accompanied by psychological problems. What are the causes of erectile dysfunction? Since a complex interaction of nervous, hormonal and psychological functions is necessary for a complete and lasting erection, the causes of a disorder can be very different. In many cases, there are several causes factors at the same time. Organic causes or risk factors can be increased blood sugar, diabetes, arteriosclerosis, arterial hypertension means high blood pressure, renal insufficiency, which means impaired kidney function, obesity, high cholesterol, urological disorders, neurological disorders, for example, multiple sclerosis, and nerve injuries. Psychological disorders, in first place, really reason number one is chronic stress and burnout syndrome. Different forms of depressive disorders, psychosocial problems within the partnership. Medications, for example, anti-androgens, which means drugs that inhibit the effect of male hormones. Anabolic steroids, which are used, for example, in bodybuilding to accelerate muscle building, and in animal husbandry, which means that we eat them with the meat. Antidepressants, antihypertensive drugs, drugs against high blood pressure, especially beta blockers. I never prescribe beta blockers to male patients because of this effect. H2 receptor antagonists, they are for the inhibition of gastric acid in case of reflux, gastritis, but they are not the same drugs as the proton pump inhibitors, sorry, like pantoprazole, lansoprazole. They are not a problem. Then corticosteroids, cortisone, alcohol, and smoking. So, what is the therapy? What do we have as which possibilities we have? First and in first place, the therapy should consist in identifying and eliminating eventual risk factors from the one I mentioned before. Treatment of organic diseases, if possible, change the causal medication, stress reduction, psychotherapeutic support for psychological problems, a healthy lifestyle with sport, healthy nutrition, enough sleep, quit smoking, and reduction of alcohol consumption. Then we have also available some pharmacological therapy. In some cases it is necessary especially if we have, even if, for example, there's no organic problem, but only a psychological problem, these drugs can help because they interrupt this cycle, you know, of being preoccupied, would it work or not, you know, but just to have again, you know, a good sexual life and reduce the anxiety. So maybe the best known is the sildenafil, very known as Viagra, and prostaglandins and yohimbine. Contraindications should be excluded before using these drugs. The use should take only place under medical supervision, so no self-medication. Because, you know, a friend gives you the drug because he used it and he was happy, this doesn't work. And then in some cases surgical interventions are necessary, but these are really rare cases. Okay, I hope it was interesting for you and you got some insight about the problem and how to resolve this, and I wish you a wonderful summer.